Good morning. Let's start our final day with a prayer. Let's put ourselves in the presence of our Lord. Loving Heavenly Father, Eternal God, I pray that you bless us in this event as we continue on our final day and keep us. Lord, make your face shine on us and be gracious to us. I pray that we feel your presence during this event because you are with us wherever we go. I pray that this event focuses upon you and plans for us as a body of believers. Our prayer today is that your will be done through this event. Take what we have prepared and multiply our efforts as only you can. Bless all the speakers and the people behind this event. Steer our intentions to align with your righteous will. Blanket us with your peace today, Father. Keep us physically safe and guard our hearts and minds from pride and selfishness. Keep love at the forefront of our minds today and the guiding light for all we set out to accomplish and celebrate. Amen.
Good morning, ISSUP Philippines. Good day and good evening to all our friends from across the globe. I am Therese Castillo, the Chair and President of ISSUP Philippines. ISSUP Philippines, with the support of the Bureau of International Narcotics and Law Enforcement Affairs, or INL, the U.S. Embassy Manila, and in partnership with the Dangerous Drugs Board, warmly welcomes you to our third and last day of our very first major virtual event for 2021. We're jump-starting the year with this event with a hope to build interest and engagement among us professionals and practitioners in the field of addiction and behavioral health to join ISSUP Philippines' second national conference in June 2021. We would like to give a shout out to all the attendees. From day one, we had almost 400 attendees, 300 of which are Filipinos. Thank you. And top 5 other countries who are consistently attending our webinars and all other events. We have friends from Pakistan, Indonesia, India, Malaysia, and the US. Yesterday, we had almost about 350 participants, 260 plus of which were again from the Philippines. And top 5 again were Pakistan, Indonesia, India, Malaysia, and Nigeria. We also had the honor and privilege to have with us yesterday the U.S. Senator Matty Hunter. Thank you, ma'am, for joining. We likewise had a few from the Bahamas, Canada, Guam, Bangladesh, Kenya, Korea, Myanmar, Nepal, Paraguay, Peru, and Puerto Rico. So thank you all so much for being with us in all our 3-day event. Okay, moving on. The world is in the midst of a most severe crisis in our time. The coronavirus has changed the landscape of everything around us. It's global in scale and massive in impact. The problem of addiction and mental health has taken an unprecedented surge. And as a network of prevention, treatment, and recovery professionals who are committed to continue to provide quality of care to people and communities we serve, awareness, knowledge, and understanding of these new challenges are key to better equip ourselves to respond with positive attitudes and evidence-based practices. Thus, our conference theme, Emerging Issues and Realities on Addiction and Behavioral Health Amidst the Pandemic, the Silver Linings of the Lockdown. Yesterday, day one, the other day, we were very privileged to have with us a powerhouse panel of speakers in the drug demand reduction field from different parts of the world. Yesterday, we listened to our very own national experts from the different government agencies and departments who have presented their adaptive responses amid the pandemic. Today is another full day of very interesting topics with equally interesting presenters who will present prevention, treatment, and recovery during these most challenging times of COVID. Please feel free to put your questions on the question box so we can collate and hopefully be able to answer all of them during the Q&A. I beg for your indulgence to those who've heard this since day one, but for those who are joining us for the first time, here's a snippet of ISSUP's vision, mission, and goals. Kat, video please.
ISSUP is an international professional society that connects, unites, and shares knowledge across the global prevention, treatment, and recovery workforce. Substance and drug use disorder are major global problems. There is enormous unmet need for effective prevention, treatment, and recovery support worldwide. Across the world, clinicians, service managers, public health specialists, researchers, volunteers, families, communities, and civil society are working hard to help save, support, and improve lives through well-organized, effective, and ethical systems and services. Evidence-based prevention, treatment, and recovery programs and strategies offer huge benefits for individuals, communities, and society. However, there are many challenges and obstacles that stand in the way of providing effective practice. ISSUP is here to help. We connect. ISSUP members are plugged into a thriving professional network for sharing practical advice and knowledge across a wide range of themes and specializations. Our online community allows you to communicate with other members and share ideas, research, and resources. Our national chapters connect you with peers in your own country and bring national focus and context. ISSUP links you with our partner organizations, developing training or supporting policy making. And we can connect you with a network of universities delivering, developing, and promoting academic education within this field. We unite. Gain inspiration from your peers, learn and share ideas. Join online and in-person events taking place around the world. Access a wide range of online learning and training resources, including courses for the Universal Prevention, Treatment and Recovery curricula. We can also help you gain internationally recognized certification and credentials through our partners, offering you the chance to verify and share your achievements. We empower the field. We break down the walls that exist between research, policy, and practice by promoting the exchange of knowledge and speeding up the transfer of knowledge into practice to improve health, education, and economic outcomes for people and communities. Join us today for free by visiting our website and discover the benefits of ISSUP.
Okay, thank you. Okay, those 3 words for ISSUP: connect, unite, and share. So we've seen what ISSUP Global is, so allow me now to introduce to you what ISSUP Philippines is. ISSUP Philippines was born out of a common desire of Filipino addiction treatment professionals who have long been trained by the Colombo Plan Drug Advisory Program through INL, U.S. State Department, to professionalize and unite addiction, prevention, and treatment practice in the country. We are a duly registered non-stock nonprofit organization with the Securities and Exchange Commission since 2014. Our claim to fame was the very successful hosting of the first national conference in Novotel, Manila in 2017. On August 5, 2020, barely 5 months ago, a new set of Board of Trustees was elected. And as we transition to the new and next normal, ISSUP's strategic thrust to sustain our momentum are 3 R's: reinvent, restart, and revitalize. Later on during the break, we will share with you our journey together as the ISSUP Philippines in the last 5 months. So aligned with ISSUP Global's vision and mission, ISSUP Philippines was able to craft its own VMV in a strategic planning session held a couple of years back. Our vision is by 2025 to be a premier organization of helping professionals of diverse disciplines in the field of substance use and co-occurring disorders prevention, treatment, and recovery. Our mission is to be able to create a safe and nurturing platform and community of professionals committed to the highest ethical standards of practice, and to provide access and training opportunities for the different curriculums, universal treatment curriculum, the universal prevention curriculum, and the universal recovery curriculums. And of course, we have the credentialing and certification. And we have also to advocate for broad-based education and critical reforms for professional excellence, and to be a center for research and development on SUD prevention, treatment, and recovery studies in the Philippines. We have also identified our core values, which are the basis of our rules of engagement. We have passion for excellence. We wear our passion on our sleeve and never settle for mediocrity. In our Filipino language, hindi pwede ang pwede na. Integrity, firm adherence to the code of ethics of ISSUP in our respective professions. And as we say, what do you do when nobody's watching? Unity and diversity. We unite across all differences, mutual understanding and harmony among diverse groups. Thus, our tagline, one in purpose, one in action. So for those who haven't registered yet as members of ISSUP Philippines, please do visit www.issup.net and go to the ISSUP Philippine chapter page. Since day one, we also had a call for volunteers for some leadership roles for our different committees. So may we ask, thank you, by the way, for all those who have submitted their letters of intent. We are still opening the call for these volunteers until I think the first week of Feb. So please do send us your letters of intent and CVs. So with that, thank you very much and enjoy more learnings and welcome to the third day. Thank you. Susan?
Thanks. Thank you so much, Chit. And good day, everyone. Susan Rivera here, member of the Board of Trustees of ISSUP Philippines, in charge of corporate affairs. Wow, that was a great opening, and also a most engaging video, Chit. It really feels most rewarding in very many ways and at all levels to reach the third day of our pre-conference, close to 400 and 300 respectively participants in the first 2 days. Indeed, a thriving community and truly silver linings we are experiencing in real time. So to our kababayans, pre-con pa lang po ito. So you can already imagine what the national conference is going to be like in June. So ensure you sign up as members and stay tuned. It gives me great pleasure to introduce our engaging lineup of speakers this morning, who will provide their perspectives on our conference theme as they practice, live, and bring to life on the front lines the very tenets that guide our collective substance use prevention, treatment, and recovery journey. Pasig City Mayor Vico Sotto obtained his bachelor's degree in 2011 with a major in political science and his master's degree in public management in 2018 with honors, both at the Ateneo de Manila University. He was previously a project associate for twin programs of the Ateneo School of Government, Government Watch or GWatch, and Political Democracy and Reforms. He served one term as City Councilor of Pasig from 2016 to 2019, where he championed the passage of ordinances on citizen participation and freedom of information, with the latter becoming the first local legislation on FOI in Metro Manila. In May 2019, he won as City Mayor of Pasig with a strong push for good governance centered on people's participation and empowerment, transparency and accountability, and greater focus on education, housing, and health. Apart, of course, from his artista looks and gracioso demeanor, he by far epitomizes the qualities of a young leader that our Filipino citizenry clearly find most inspiring. Mayor Vico will be our first Bueno Manos speaker in the plenary. Dr. Miriam Cue is a person of firsts, demonstrating her pioneering spirit. She is the country's first registered and licensed psychologist. She has 45 years of professional experience as teacher and clinical practitioner. She was the first Filipino psychology professional to be certified by the Psychological Association of the Philippines, or PAP, in 4 specialty areas: clinical psychology, counseling psychology, assessment, and industrial organizational psychology in 2009. She was also one of the first 2 Filipinos to be awarded international certification as an addiction professional at level 3 by the International Center for the Credentialing and Education of Addiction Professionals, now known as Global Center for Credentialing and Certification. In 2012, she was appointed as the first member of the pioneering board of psychology by then President Corazon Aquino. In the same year, she was awarded as the most outstanding professional counselor of the year by the Foundation of Outstanding Professionals and the Professional Regulation Commission, or PRC, in which she is now chairperson for the Professional Regulatory Board of Psychology. She is also Global Master Trainer on the Universal Treatment Curriculum for Substance Use Disorder under the Colombo Plan Drug Advisory Program. Clearly, Dr. Miriam's stellar reputation precedes her. She will be our second speaker in plenary. Last but certainly not least, Giovanna Campello is Chief of the Prevention, Treatment, and Rehabilitation Section of the United Nations Office on Drugs and Crime, or UNODC. Giovanna has more than 20 years of experience with the UNODC in supporting the member states and stakeholders at all levels in improving their drug prevention response, applying and contributing to scientific evidence. Most notably in this context, she has led the publication of the International Standards of Drug Use Prevention in 2013 and the UNODC World Health Organization's second updated edition in 2018. In her leadership of the Prevention, Treatment, and Rehabilitation section of the UNODC since 2016, she has progressed the promotion of evidence-based, gender and human rights sensitive practice on drug prevention, treatment, care, and rehabilitation, as well as access to controlled drug and medical purposes. Ms. Campello has a Bachelor of Science in International Relations from the London School of Economics and Political Science and an MA in Gender and Development from the Institute of Development Studies of the University of Sussex, both in the UK. She will be our third speaker in plenary. She cannot be with us live, but she sent her recorded talk. I now turn over the floor to our first speaker, Mayor Vico, please.
Good morning, everyone. Ma'am Susan, thank you for that very generous introduction. It's my honor and privilege to be with you here today. Of course, I would like to greet everyone from the International Society of Substance Use Prevention and Treatment Professionals, or ISSUP, to our friends from INL, the U.S. State Department, to the Colombo Plan Drug Advisory Program, UNODC, and everyone else, all of our participants who are here. Very briefly, I'd like to discuss the programs that we have currently with our ADCOP, or our Anti-Drug Abuse Council of Pasig, and then moving on to the lessons that we have learned, especially the lessons we have learned, especially focusing on the lessons we've learned during this pandemic. This pandemic has really turned our lives around for better or for worse. It's changed the way that we do things. It's changed the way that we've done things in government, but not just in government, but really our everyday lives. Needless to say, not just in Pasig or in the Philippines for that matter, but in the entire world, we've seen how things have changed. Obviously, this comes with a lot of hardship. We've seen the numbers, even in our economy, go down. A lot of people have lost jobs. Here in Pasig, just one little piece of data that we have is that 5% of businesses have actually closed, and these are mostly small businesses. And when it comes to drug abuse, we know that, or we've seen that, as you know, as we have economic hardship, drug abuse does tend to go up. And so we'd like to share a little bit of what we've been doing. Obviously, this has been very hard, but I'm very proud of our Anti-Drug Abuse Council. And when I say our Anti-Drug Abuse Council, this doesn't just mean the local government itself, but also the civil society representatives, the schools, the barangay governments, the barangay civil society organizations and members. This has really been a team effort. Obviously, our program is far from perfect. There are many things that we continuously learn, a lot of things, suggestions that you have given us throughout the years and especially in recent months. But just very quickly, I'd like to please allow me to go over the slides that we have. This is the slides that we have focusing on the community-based drug rehabilitation program, or addressing the demand side of the drug problem that we have. Definitely, we know that drugs, illegal drugs, is still a problem. Substance abuse is still a problem in our city. Hopefully, the numbers and the data shows that the situation has been improving, perhaps slowly, but but importantly, steadily. Um, you know, as all of our participants would know, that the battle against illegal drugs is really twofold. And we have the battle on the supply side, going after drug pushers, drug syndicates, and definitely we cannot forget about this side. But unfortunately, sometimes when we look at the news, what we see even on social media, we focus a little bit too much. Admittedly, the local government sometimes focuses a little bit too much on this supply side problem. I'm not saying that we should forget it. Definitely, we should continue to focus on that and the interventions we have there. It is a peace and order problem as well. But when we talk about the other side, which is the demand side, or the side of the those who are addicted or who use drugs, or persons who use illegal drugs, this is something that I think all governments, speaking generally, can focus on. And what we've been doing so far, if we can go to slide 2 of our presentation, we've tried to start with the schools. This is the campus tour for our kids. We start at the elementary school level, and then slide 3, we have until the secondary school level. This is Barkada Contra Droga. We try to make it engaging. We try to make it fun, at the same time educational. We understand that when the young or the youth understand the ill effects of drugs, and they're not just told to stay away from it, or not just hindi lang yung tinakot sila, they're not just scared away from it, but they should really understand. And there are, for the elementary school at least, we try to make it lively and entertaining with even song and dance numbers. I could give you a sample of the song and dance numbers, but you might turn off my video right away if I do that. Yeah, slide 4, we have, and going to the college level, we have seminars focusing on the student leaders. And then slide 5, all the way up to the workplace. These are some of our interventions: drug abuse prevention in the workplace, promoting a drug-free workplace. Of course, we also have our drug testing laboratory here downstairs at our City Hall. Next slide. We try to engage all stakeholders. So we've discussed students, we've gone to the workplace. These are for our homeowners. We have seminars that are for our HOAs, or homeowners associations. Next slide, we have more specifically targeted sectors. Lakas ng TODA, laban sa droga. TODA is our tricycle operators and drivers associations. We have more than 10,000 tricycle drivers, probably close to 20,000 tricycle drivers, since some tricycles have 2 or more drivers. So these are more targeted interventions per sector. And then for parents, we have our STEP program, slide 8, systematic training for effective parenting, or STEP. Slide 8, please. This is a relatively new program. We've trained just 60 participants here, and then we try to engage even the principals, the teachers, the guidance counselors, the GLAD coordinators, of course the PNP. We also try to involve them with these projects. But I think one important thing that we should point out is that we really try to involve and engage our civil society. So one of the most active groups are our faith-based organizations. So we involve churches, obviously not favoring any specific denomination or religion, but just involving them. Also the national agencies, DSWD or city SWD or social welfare department, groups like the Rotary Club of Pasig, and then Sagip Kabataan. Then we have our substance abuse treatment office of Pasig, or our Sotto office. So these participants have been trained to become. We've sort of built a Pasig Speakers Bureau, so that any sector, any group that might want a drug education program in their respective office, or again homeowners association, that we can easily tap people from our speakers bureau to go down and engage our constituents in that area. Slide 9, we have the drug abuse prevention program for anti-drug advocates. Obviously these pictures are pre-COVID. The challenge really has been, you might be wondering why there's no social distancing. This is before March. We do this at the barangay level as well. The challenge really has been, what do we do now that we have to strictly implement our health protocols? We can't really have these big events like what we've been showing some in the previous slides. For students, we don't have face-to-face interaction with our students right now. Moving on to slide number 10. But despite these challenges, obviously we have to continue. We can't stop, especially as we've mentioned that the numbers or the situation of our economy is not, the economy is not at its best right now. We can put it that way, and so we cannot we can't afford to stop with our drug abuse intervention or programs. And so we've continued even with our barangay drug clearing program. At the moment, we have 16 out of 30 barangays that have been declared as drug cleared following the parameters set by the Dangerous Drugs Board and PDEA. 14 are under process. We hope that by the first quarter, at least 2 more will be declared drug cleared. Obviously, drug cleared is different from completely or 100% drug free. We know that if barangay is declared drug free today, tomorrow there could be a pusher comes in, so we have to be on guard and remain vigilant even in these barangay drug cleared areas. So we offer a 500,000 peso reward to the barangays who have cleared. They've been the barangays that are lined up for barangay clearing right now. We have around 5, and then 2 that are almost done. They've really been having a difficult time because of COVID, but we've still continued despite all of these challenges. One of the things that has helped us is the Tagamasid project of Pasig. That's in slide 11. This is an important part of our anti-illegal drug campaign. This is from an old ordinance, a 10-year-old ordinance that we have. We have a hotline which serves as a reporting mechanism, and not only do we commend the law enforcers who are involved with buy bust or any operations that lead to discovery or confiscation and of drug supplies and arrests of drug pushers, etc. But we have a reward system also. And then the next slide. We also have this sumuko ako sa gabay ng iwas droga program Sagip. But if we notice, if we rearrange the letters of Sagip, we'll actually form the word Pasig. This is our community-based drug rehabilitation program. And I'm very happy to say that while, again, going back to the challenges of COVID, that we did not stop with our community-based drug rehab program. We understand and we fully embrace the importance of a strong community-based drug rehab program in the battle against illegal drugs. No matter what we do in the supply side, if we don't rehabilitate those who are addicted to illegal drugs, then it will just be an endless cycle. And we've seen the studies. We want to be evidence-based in our approach. We want to be data-driven in our analysis and policy making. And we understand, and we've seen the data. Even the Department of Health has said that 90% of those who use drugs don't actually need to be placed in a rehabilitation facility. 90% of those who have used drugs can actually be rehabilitated in their community. And this might even be better because you don't pull them out and isolate them, but you try to reintegrate. We want to reintegrate them into society. We want to make sure that they get back to more normal lives, reintegrated into their families, their society, and not just pull them out and throw them into a rehabilitation center. And so, despite the challenges of social distancing and all of these health protocols that we have now, if we can go to our next slide. Again, this is a continuing program for the whole person recovery of our what we call PWOODs, or persons who use drugs, persons undergoing our aftercare program. So this slide shows our family enrichment or individual and group sessions, capacity buildings, and programs. So the codependency seminar, personality development, home visitation, physical fitness is also very important, and then seminars as well. And then next slide is the moral and spiritual intervention. We want to be holistic in our community-based drug rehab program. We don't want this to be just a token program, but we want to make sure that it's holistic. I don't have much time to share everything, so I'll just go through the remaining slides very quickly. I don't want to go over time. So slide 15, we have our skills training, livelihood, job placement, community service. We want to reintegrate them into community. We want to destigmatize what they have gone through. So we've tried to even partner with companies who would hire them later on after they complete the CBDRP. Next slide, psychosocial intervention program. Katatagan kontra droga para sa komunidad. Again, we want to be holistic and next slide. This is our youth program. I won't expound on this anymore because of time limitations. Next will be our rehabilitation and treatment. If 90% don't need to go through rehabilitation in a actual rehabilitation center, of course there are still the 10% that need this. Next, our validation workshop conducted quarterly with our partners like PDEA, the PNP, etc. And here, the AGCO program amidst the pandemic. I think this is very important. Again, the pandemic might have slowed us down a little, but it didn't hinder us from continuing with our community-based drug rehab program. We distributed food packs to minimize the economic hardship of our affected or persons who use drugs. And then we give the ayuda but we don't want this to remain just a dole out or short-term dole out. So we maintained our kamustahan, if not through face-to-face, especially during the enhanced community quarantine. We made sure that we at least text or call them through using things like Facebook Messenger, which is free, and then involvement in barangay activities amidst the pandemic. So here we have a picture of one of our persons who used drugs, who was able to actually convert what the city government gave as quote unquote ayuda, and then this person actually transformed that and made it into a business. Okay, so next slide, please. And now we've actually, this is the last slide. Now we've been, now we can do a little bit of face-to-face, but obviously it can't be like what we had before, that we had a lot of people gathering in a room. The health protocols, like the room has to be well ventilated. We have to limit it to maybe 10 participants at the most. But all in all, as we go through this pandemic, there are also opportunities from this pandemic. What we've noticed is that people are more open to change because of the pandemic, because of everything, how it's upheaved it just turned our lives around, turned our lives upside down. The silver lining is that people are more open to certain changes. We can introduce new things, and when it comes to we in the media, we often hear the term the war against drugs, and I think if we really want this so-called war against drugs to be successful, then we really have to challenge the norms. We have to challenge how we think of this issue and how this issue is approached at the barangay level, how the ordinary Pasigueño, the ordinary Filipino looks at a person who is addicted to drugs, a person who is under community-based drug rehabilitation. First and foremost, we want to start treating this more like a healthcare issue. We want to challenge the norms and destigmatize concepts like addiction, rehabilitation, substance abuse. We want to educate Pasigueños because we believe that as the correct information is disseminated on the ground, then and second, we involve all stakeholders. We empower the stakeholders from the schools to the students to the parents, to the people at the workplace, to the police, to the people in the local government and other civil society and non-government organizations and members. As we connect, unite, and share, then we will be able to better tackle the problem of drugs in our communities. Thank you very much. God bless, and may we have a productive rest of the day. Thank you very much.
Thank you, Mayor Sotto. I hope that there were other LGUs who were able to listen and be inspired by the examples you have shown, and particularly also the other countries now listening. Now we would like to go to the clinician's point of view. We would like to call on Dr. Miriam Cue. And please do stay for the question and answer for all the panelists. Thank you.
Okay, great morning, everyone. To my co-panelist, okay, Mayor Vico.
Can you please turn on your video, your camera, please? Thank you.
Okay, so thank you. The presentation of Mayor Vico was indeed very impressive and very inspiring, so that with a mayor like him, I would say that there is hope for the fatherland. So I'm here as a clinician, although I was introduced as a regulator. Now, during the first day, Mr. Brian Morales mentioned about the need for governments to recognize and acknowledge, okay, the certifications of addiction professionals. Like it or not, in our country, we have a regulatory commission and a regulatory board. But as part of the regulatory board, okay, I would say maybe I can help in this regard. Now, but I am not here this morning as a regulator, but basically as a clinician. So we are faced with this pandemic. So the question is, how are our persons, how are people who are using drugs faring in this pandemic? So this is the question now. So with given the topic that has been given me, let me share with you some of my I would say my observations as a clinician. So these observations basically come from my own clinical practice as a private practitioner, also as some inputs also from a residential treatment facility where I am also connected, okay, and then from church and community-based treatment programs, and also from government outpatient treatment programs. So I also took time to interview people who are connected with government outpatient programs. So let me, in brief, okay, let me present to you some of the issues and challenges our PWODs are facing now. Okay, so the first issue is about stress, anxiety, tension, depression, frustration, and anger. Okay, if you would ask them, okay, the clients themselves, they would say it's because of the unprecedented changes taking place, you know, the volatility, the uncertainty, the complexity and ambiguity of the world, and the drastic lifestyle changes they need to adapt to. Okay, more than this is the feeling of isolation. Isolation is particularly an issue among us Filipinos because of our need for social connection, our connectedness. So while we are told to do some social distancing, we couldn't help but do some distance socializing through social media. And because we are social beings, basically, somehow we have gotten the title, the social media capital of the world. Okay, so that's because of our sense of connectedness. And this I would like to emphasize as we move on later towards a Philippine model for intervention. And I'm very glad, very happy about the presentation of Mayor Vico, because from this, maybe we can move forward. Okay, so stress and anxiety, anger, frustration, okay, all this have been expressed, okay, because of restrictions, perceived restrictions from the environment. This I will explain later. Another issue is boredom, okay, and the pandemic fatigue. We have long been in isolation. 10, 11 months, we have been isolated due to the lockdown for many of us. Social activities have been restricted or limited, okay? It's not easy to see friends, join gatherings, and somehow we never really know when this will end. Things are so uncertain. We wait for things to go back to the way they used to be, but apparently life is no longer the same. And when we speak of boredom, okay, our clients would say they have too much in their hands. Now, it's not the lack really of anything to do. There's so much to do, but I would say the lack of options, okay? Alternate activities from where they find the needed pleasure or at least enjoyment and satisfaction. And boredom is a real challenge to sobriety. Another issue, okay, of course, is work and work-related financial issues and opportunities. Okay, nothing is actually more stabilizing than work. Why? Because work offers secure livelihood, provides self-affirmation, it strengthens our self-esteem, and it provides us long-term social contacts. So in work also helps us structure our daily activities and strengthens our sense of self-worth. So work is also, in a sense, very essential to social integration. Now, everyone has become vulnerable during these times because of unemployment, which is rising rapidly, and no one expects recovery soon. Even for those who have imagined themselves to be safe in their positions are actually in danger also of losing their jobs. So how much more for those who have, for our brothers and sisters in the addiction world who have, limited opportunities to find meaningful work. And some of them who just started work may have lost their jobs, okay, or lost business opportunities for those who are more affluent. So, so this is another issue that is actually putting on pressure to many of our clients. And for the affluent who have gone through rehab in more controlled environments and facilities, they are afraid that even after they move out into the world again, business and travel plans which are discussed during treatment are hampered. And for those who are out there in the community, okay, for those who have been employed, who are still employed, working from home amidst all the tensions and conflicts within the family is not that easy. So these are some of the issues. Beyond the issues, can we go to the next slide, please? Are the pressures from family members, problems and conflicts. These pressures normally relate to the push to do something, the push for productivity from family members. And family members themselves are also under pressure to meet ends, especially if the family is also suffering from financial crisis. So when people actually put together at home, lockdown at home with their varying issues, conflicts are inevitable. So that's another issue. Then frustrations due to needed adjustment changes in program treatment structure. For instance, in the facility, okay, so we have a 6-month program, 3 months intensive care, another 3 months intensive outpatient care, where patients can actually go home. So many of our patients, residents, think that they can actually go home after the 3-month period, but somehow because of the need to contain infection, the need to protect the safety of other residents, somehow there have been changes in this regard. Some of them are not able to go home even on the 3rd or 4th month of treatment and with the lockdown. So that's one. So the frustration. Now, for most government facilities, even outpatient programs, government outpatient programs, there have been changes in the service continuity plan, like in the mode of service delivery. Now, accordingly, face-to-face contact has been limited. They now do this outside the building. They do this outdoor, but with protective personal equipment. So you can just imagine dealing with a group, with a counselor, using PPE, but this is also a health protocol because we don't know where the members of the group are actually coming from, which areas, whether they are safe. So thus the use of helpline, okay, they call for those who do not have any gadgets or Android phones, and of course virtual counseling and consultation for those who have access to the internet and who have gadgets. But even with this access to the internet, okay, telecounseling, teleconsultation has been limited due to internet connection issues, okay, problems with gadgets and phones. And beyond this, okay, beyond all this, because many of our PWODs, okay, don't have that easy access to drugs anymore, with more controlled in a more controlled environment, even outside the facility, okay? The symptoms of co-occurring disorders, particularly psychiatric symptoms, have become more pronounced, thus increased vulnerability and will increase vulnerability to use and relapse. Okay, next slide, please. So basically, we have this theory, the stress diathesis stress dual risk model, which points out that vulnerability plus a very stressful environment, the diathesis, the predisposition, the particular brain dysfunction or any traumatic experience which can predispose the person to mental health disorders or mental health issues, plus an environment that's highly stressful, can actually lead to end up with use or serve as triggers. These environments, stressful environments, serve as triggers to drug use and relapse, okay? Another theory, okay, to the aggression would be the frustration aggression theory, which points out that frustration leads to aggression, and that aggression is usually the outcome of frustration. So especially in limited environments where, you know, some of their freedom is curtailed, some expectations are not met, even in the community, so people can also be aggressive. And one important issue I would like to present is the reactance theory. Next slide, please. Which states that threat to or loss of personal freedom can motivate a person to restore that freedom. And usually this motivation is, I would say, unpleasant. Now, and this reactance, this intense emotional state is manifested through actions or behaviors that restore freedom. So I'm just presenting some of these views to help us understand the behavior of our PWODs during this pandemic. Okay, now, what are these realities they are facing now? So basically, okay, we have it was mentioned by the other speakers that there is more supply actually of substances, but to the mind of our people, there's limited availability and supply. Now, the impact is for among the poor, limited accessibility is actually helping them decide to do something about their life. So because there is the need to say, well, they say it's difficult. You don't have the money. It's difficult. People are watching, so maybe I can take it tomorrow or next day or next day, and then the weekends, and he has not taken anything. It has helped abstinence. Yet, despite the choice, there is still choice in here, though limited. But the thought that it's not easy to have access somehow strengthens their position that they can actually live without the drug. Okay, and but for the rich, for the affluent, there's access. They can use, they have found a good delivery system, methods of accessing. So this has different impact on the rich and the poor. Now, another reality is restriction to gatherings. Okay, if you look at the Filipino way of doing things, even for drinking, we usually drink in social gatherings. People take drugs in sessions with several others. So using is now relatively isolated and at home, and this is un-Filipino. And this, with reduced drug pressure, peer pressure, somehow things are also contained. Okay, and then lastly, now for the silver linings. Okay, during the last lockdown, just two more slides. Okay, so there's now increased insight of the PWODs in the community that independence from substance is possible. And with this is more active engagement also of families in the treatment program, because they see that people are not using as much as they did before, and people are now turning to faith and more mature spirituality. That's why Mayor Vico mentioned about faith-based programs which help his people, and then more active initiative among those who are affected, taking initiative for their own treatment and follow-up sessions. Okay, instead of being pushed to seek treatment, many of them now seek treatment on their own. Then last slide. Okay, so there's also the realization of the public that substance use is a mental health issue, that it's not a character flaw. So people are more acceptant of their need for help, and that people are realizing that we all need to take care of ourselves and our own mental health, especially in these trying times, especially with the realization that we are all living on borrowed time. And there is a need to arrive at a more effective approach to prevention, treatment, and recovery, sensitive to our culture, beliefs, and traditions. And Mayor Vico is just starting this. So we need to, with what he has started with, maybe together we can come up with a Philippine model of intervention for PWODs that would consider the sociability and connectedness of the Filipino, his religious psyche, his faith-based approach to life, and many more. So thank you very much. So so our infirmities, whatever they are just opportunities for God to display his gracious work in us. So that's a quote from Charles Spurgeon. So great morning, everyone. Thank you for the time given me.
Thank you for that wonderful presentation, Doc Miriam, as you are called in the Philippine community and I think also in other parts of the world. So now we go to the recorded presentation from the UNODC. Kath, can you please play the video now? Thank you.
Hello, dear friends at ISSUP Philippines. Warmest greetings from Vienna. even if it's a bit cold at the moment. Big apologies for not being able to be with you live. The technology has made the pandemic bearable in many ways, but we still have not found a way to solve the time zones. And by the time you're meeting, I will be fast asleep. And this is, I feel very weird recording a message for you all, but it's still better than nothing. I still keep you in my thoughts, even if actually they will be my dreams, right? And I know that if you have ideas, if you have comments or questions on something that I will say, it will be easy to contact me. So I want to tell you a little bit about what we observe with regard to drug prevention and treatment. And I would like to share my screen and my presentation if you allow me some time to do this and do this. Olivia, can you see the presentation?
Yes.
Thank you. So as I was saying, I want to tell you a little bit about what we have observed with regard to drug prevention and treatment during the pandemic, what we have done about it, and some implications for the future. And I would like to start from the actual services for people who use drugs and people with drug use disorders. Of course, services that should encompass treatment, healthcare, social protection, rehabilitation, all those services that are needed to protect and enhance the health of people with drug use and drug use disorders, and of course, promote, if they so wish, their recovery. So I think we are all very aware of the basic global statistics on the situation of the 35 million of people that with drug use disorder globally, only 1 in 8 are in treatment, and the result of this deficiency is very clear in the figures with regard to the years of healthy life lost to drug use disorders and their comorbidities, and unfortunately as well also drug-related deaths, and we have 500,000 of drug-related deaths annually, and in vast majority preventable. In addition, we also know that this epidemiological data masks severe inequalities, not only at regional level, but also for population that for a variety of socioeconomic reasons find themselves in situation of vulnerabilities. I'm thinking, for example, about women, people in prison settings, people in humanitarian settings, and so on. And the pandemic hit hard. So the impact of the pandemic on people with substance use disorders has been very noticeable. Look at this study for One for All that shows how people with substance use disorders have been 8.7 times at greater risk for COVID-19, with people with opioid use disorder faring even worse, 10.2 times higher risk, and compounded with significantly worse outcomes, more death and more hospitalization. And this at the time, of course, unfortunately, when services for this population have been also being hard hit. The Prevention, Treatment and Rehabilitation section has participated in a survey of professionals in almost 80 countries organized by ISSUP, the International Society for Addiction Medicine, and I'm presenting some data for you. So look at this. While more than 80% of the professionals reported that the core medical and psychiatric services did continue, this is the orange line here, and it's good news, right? But look at the blue. Only half reported the existence of continuity plans prior to the pandemic, and many reported shortages of methadone, buprenorphine, reduction of outreach and overdose prevention services, and reduction of services for immigrants and refugees. So there is a huge challenge there that we can and we should meet together. We need to increase the coverage of treatment services fast and dramatically, and as part of the push for universal health coverage. This dramatic increase would also have a strong impact on comorbidities and drug-related deaths. As we have seen in the result of our joint SOS initiative together with WHO, Stop Overdose Safely, that we were able to implement only in Eastern Europe and in Central Asia, but that we would like to expand much more. And of course, we know that coverage is not enough. So too often services are not evidence-based, or they subject people who use drugs and people with drug use disorders to cruel, inhuman practices or punishment, and this has to stop. Services should follow the UNODC WHO international standards for the treatment of drug use disorders, as it is encouraged by member states themselves. And together with many colleagues in international organizations and civil society and academia, we are developing a toolkit on quality assurance, precisely to allow member states to create quality assurance mechanism to improve the quality and the situation of drug treatment services and systems in their countries. And as part of the improvement of coverage and quality, we need to build back better from the pandemic. We need to be prepared with continuity plans to maintain and integrate evidence-based services, including the necessary medical supplies. We published some suggestions already in March, and I'm looking forward to expanding them and disseminate them all over the world. As particular focus, another issue that the pandemic highlighted is prison overcrowding and how this is a threat to the health and security of all. So we need, and we can, increase the provision of alternatives to conviction or punishment in general for all people in contact with the criminal justice system, but also in particular for people who use drugs and people with drug use disorders. For example, providing treatment services as an alternative. We can do this at all stages of the criminal justice system, way before arriving to court and prison. It is cheaper and more effective. Together with WHO, we have published a handbook that is packed with principles, examples, and best practices. If we disseminate and implement this globally, this will strongly contribute to reducing prison overcrowding. During the pandemic, we have already seen some great examples of this. They were ad hoc, but we can build on them. And there will be, of course, some people for those for which alternatives are not possible and they need to be in prison. And for these people, of course, services must be available in prison settings, at least at the same level as in the community, as per the Mandela Rule. There are already great experiences in addressing particularly HIV and other infectious diseases in prison settings. These are great, particularly in the context of the pandemic, but it's absolutely crucial that mental health, including drug use disorders, receives the same attention. And I'm pleased to announce that we are starting to work on this, and in this field there had been a gap so far. So this is all for some ideas with regard to services for people who use drugs and people with drug use disorders. Let me turn now to the issue of actually preventing the people need services in the first place. So the need for strong prevention systems based on scientific evidence. And I think we would all agree that in the last 10 years, we have collectively, of course, come a long way to understand what works and what doesn't work in drug prevention. And I hope and I know that you're all familiar with this publication, the standards the UNODC has developed jointly with WHO, and that summarize the available scientific evidence as to the effectiveness of prevention strategies. And it's summarized in this table, right? That lists all of the strategies that have been found by scientific evidence to be effective in preventing drug use and other risky behaviors. And as you can imagine, and as I know some of you are very well aware because we are in this work together, it was not easy to move stakeholders globally to embrace evidence-based prevention, and moving to a prevention that is not only based on the provision of information about the danger of drugs, although this is also essential to impact the perception of risk, which is a powerful protective factors, right? But moving to a prevention that addresses also all of the complex factors of vulnerabilities in the individual, in the family, in the community, and that really promotes the safe and healthy development of children and youth. So it was not easy, but thanks to the collaboration with many national stakeholders, donors, fellow international organizations, non-governmental organizations, including ISSUP, we were making good progress, including here in the Philippines. And then the pandemic struck. And when we started to think what could be done in terms of protecting the mental health of people, as well as protecting children and youth in particular, we really thought that what we needed to do was to support parents. And let me describe how we got to this conclusion and what we did. So we know that the two most important protective factors in the lives of children and youth are parental warmth, so parenting with positive and loving affection, and monitoring, being involved in the lives of children. So look at these studies showing how the combination of parental warmth and monitoring results in the lowest probability of using drugs. In this case, stimulants on the left and prescription opioids on the right. We also know that the vulnerabilities in the family interact very powerfully with inequalities, with people from socioeconomically marginalized communities 3 times more likely to experience many adverse childhood experiences, including in the family, and this in turn increases their probability to develop substance use disorders later in life. And we know that the pandemic has highlighted inequalities, the role of inequalities in health very strongly. But this is why already before the pandemic, UNODC had developed parenting programs to help parents be better parents in fun, easy ways, and programs that are at the disposal of everyone because they are tailored to low resource settings and are in the public domain. Here you see them, Strong Families and Families United, and programs that we know are effective not only in normal circumstances, but also in very difficult circumstances. So for example, in very violent communities or very poor communities, or for displaced populations, for refugees, for both boys and girls. And we know from the work of the WHO that they are programs that are effective in promoting mental health and in preventing violence. And this includes youth violence and child maltreatment. Now, I think you can see how all of this became extremely relevant because of the pandemic. But if not, please look at this report from Save the Children. It shows how children have experienced increased violence in the family during the pandemic, particularly when the household had lost income, and particularly when children cannot be in school because of the pandemic. Again, families and inequalities. So that is why we have developed special tools for parents on how to cope with the stresses of the pandemic in a way that increases the resilience of the family and of the children. On the screen, you can see the 6 official languages, but we have them available in almost 40 languages if you follow the QR code, and they are at the disposal of everybody. And we have also developed additional tools for parents in very difficult circumstances, for example, in refugee camps or in very crowded communities. And finally, cherry on the cake, a new phase of Listen First campaign that has been online since November. We have a brand new website. If you have not seen it already, please check it out at our URL, unodc.org/listenfirst. all together very, very easily. You have the QR code in case. And we have 10 brand new videos and fact sheets for parents on different aspects of being a parent and being that preventive force in the lives of children. And I know I'm running a bit out of time, but I want to show you at least one video. It's very, very short because I hope it will be of inspiration. Here it is. Aha, here we are. So I hope the video has inspired you, and many of the other videos are already out, and the last one will be launched in February. And I really, really hope that you will join our campaign on social media in the next few months and spread these powerful and positive messages. And to conclude, let me express another positive message, and let me express my hope of a new large-scale mobilization of all partners at all levels to promote and protect the health of children, youth, families, communities, including, of course, in premise, people who use drugs and people with drug use disorders. And I'm very much looking forward to keep on working together. Let me thank you for your attention, and let me close my presentation now. I would really, oopsie, and I think you might be able to see me now. And let me close the presentation to at least thank you for your attention in person and wish you all the best. Do get in contact if you want to discuss more of what I've presented to you, and keep well and safe. Thank you.
Thank you so much, Joanna from Vienna, and Giovanna. Is it the same as Joanna in English? Anyway, we would now like to go to our 5-minute health break. Thank you so much for staying in touch and in tune for the first 3 panelists, as we will have 3 more panelists after this. And during the break, allow us to present ISSUP Philippines from the time that we started our term last August 2020. We have a video prepared for you, and enjoy it. Thank you. Kat, please play the video.
We were strangers, starting out on a journey, never dreaming what we'd have to go through. Now here we are, and I'm suddenly standing at the beginning with you.
No one told me I was going to find you. Unexpected, what you did to my heart. When I lost hope, you were there to remind me this is the start. keep going on.
Starting out on a journey. Life is a road and I wanna keep going. Love is a river, I wanna keep flowing. In the end, I wanna be standing at the beginning with you.
I hope you enjoyed watching that video we have prepared for you since we started last August. And would you like to be part of the journey? That's a question we pose to everyone here today. And for the past 3 days, we've been calling to anyone who would like to volunteer if for 2021 to make a lasting difference in the lives of others, to enable and empower yourself and learn from a global network of professionals. Do become part of this journey by sending your CV to cheat.isophil@gmail.com. But there are steps that you do need to make. Please go to isup.net. That's ISSUP.net, where you please do click on Philippine chapter and apply to become a member. After which, do send your CV to chit.isophil@gmail.com, and hopefully we are able to receive your letter of intent before February 5, 2021. So do become a part of this journey. As the video has said, we have only just started and we can do more with you being part of ISSUP Philippines. Thank you. So we'd like now to call on Maling to introduce the next three of panelists for this afternoon. Thank you.
Thank you. Thank you, Tito. I hope you can hear me. Anyway, for the next three speakers of the plenary three, we will start with Therese Castillo. Ms. Therese Castillo is a registered psychologist who specializes on addiction treatment, recovery management, and mental health. She is currently the project manager of the Philippines initiatives of the Colombo Plan Drug Advisory Program, where she is also a global master trainer for UTC and WISE, that's Women Intervention for Substance Exposure. She is a global DDR trainer under ISSUP. She carries with her 9 years of clinical practice in the field of addiction treatment, primarily with Seagull's Flight Foundation, Inc. Coco, as she is fondly called by family and close friends, graduated BS Psychology and AB Guidance and Counseling from St. Scholastica College, Manila, and acquired her master's degree in psychology, major in clinical psychology from De La Salle University, Manila. Her first publication, she has presented research in local and international conferences. Her first publication on the recovery experience can be found in the Philippine Journal of Psychology. She has received international credentials as an international certified addiction professional. Along with this, she's also the founder and owner of a startup business, Camp Coco Wellness Alternatives, a mental health and wellness resource. That's Coco or Therese for you. And now our second speaker will be Ms. Gilda Gayle Gomez, registered psychologist, also a registered psychometrician, a certified specialist in counseling psychology, and certified specialist in assessment psychology. Took her Doctor of Philosophy and major in clinical psychology in Ateneo de Manila University. She's the coordinator in the Psychological Association of the Philippines Special Interest Group on Substance Use Prevention and Recovery. an associate professor in the Department of Psychology and Graduate School in Ateneo de Naga University. And of course, we have our third speaker, or our last speaker then for the morning is Hydie M. She was a college chemistry professor for 5 years before joining the government service as a water quality division manager, where she has been working for the past 30 years. Hydie is a widow and a mother of 2. She finished her master's in participatory development at Davao Medical School Foundation, Inc., and master's in environmental management with Sedet Foundation in Spain. She is a team leader at the Davao Food Safety Team, who are professionals and experts on food safety and quality. She's a fellow at the International Atomic Energy Agency, IAEA, in Vienna, Austria, on isotope hydrology, specifically studying the age and fingerprints of water. Interesting, right? Also a fellow in Lund University in Sweden in urban water and sanitation. She strongly advocates the vision of the international partnership on the Satoyama initiative, which is on man living in harmony with nature. She was introduced to drug treatment and recovery because of her son, who had a problem and substance use disorder and needed treatment during the height of the pandemic. Since her work is on quality and safety, she realized to put into reality and practice in her own life what she believes in, which is safe and quality life for her and her family. We are truly privileged that Hydie is with us this morning to share her own journey in treatment and recovery in this very challenging time of the pandemic. So without further ado, I'd like to call on Ms. Therese Castillo as our speaker, first speaker. Thank you.
Thank you very much, Malin, for your very generous introduction. Hopefully you can hear me. Everyone can hear me, and then you can all see my presentation. First of all, to everybody who's listening and watching this, good morning, good afternoon, and good evening, wherever you are in the world. And I'm very pleased to share with you, we've had a very inspiring morning with all the speakers in the plenary from the UNODC, of course, Giovanna Campello, Dr. Miriam Cue from the PRC, Dr. Gomez, who will be speaking later on, Hydie, a member of the recovery community, and of course, starting us off this morning is Mayor Vico Sotto from the Pasig City. So allow me to be able to share with all of you the work that we've been doing at the Colombo Plan Drug Advisory Program this morning. Next slide, please. Okay, so really briefly, it's really just for us to share with you on this third day of the pre-conference event of ISSUP Philippines, who have put this event together very well for all of us. First, for us to share with you who we are as the Colombo Plan Drug Advisory Program, and second, what have we been doing since the pandemic last year, and thirdly, what are some of our insights and takeaways from delivering our programs and services in a different platform, in a different way, reaching out to other Filipinos and also our member countries across the globe. So let me start with talking to you about the Colombo Plan. Maybe some of you are already quite familiar with what we do. Some of you, it might be new. So please do spare a few seconds of us sharing that with you this morning. Next slide, please. Okay. So hopefully you can see that. So first of all, of course, Drug Advisory Program was established in 1973 to address the growing problem of substance use in the region. So since then, DAP has been very active in responding to the needs of the member countries through a variety of programs that maybe some of you have attended to, some of you have been trained on, a lot of the courses that we have available. So our initiatives ensure a holistic approach to fulfill the main thrusts of DAP on capacity building, international conferences and meetings, and providing technical assistance to many countries. Next slide, please. There. So this is the DAP network. It's a growing family, and I guess on a normal or a pre-COVID situation, we would all be gathering and meeting in a conference, saying hello to each other and catching up. But yeah, so we've mainly started in the South and Southeast Asia, and now present in Africa, South America, and Central Asia. So hopefully someday soon we could all meet face to face. So this is the network of DAP. You could see us in many countries. Next slide, please. So we have created a global impact to a lot of the innovative programs that we've done over the years. Next slide. Okay. So since the COVID-19 global pandemic, the previous days and speakers, I've been reflecting on a lot of these things that we were learning, and we are, we seem to be in the same boat on what we are experiencing in region communities, reaching out to the people that we serve. And since then, we've not been able to travel, we've not been able to meet face to face and connect just like we used to. So this session allows me to share with you how Colombo Plan DAP has been making an impact since we've had these restrictions that we've been facing since last year. Next slide. So carrying out our project activities required a lot of innovation, strategic solutions, and alternative routes to implementation, similar to what we've seen in the presentations today and also the first 2 days. So let me share our programs, our activities on curriculum development, and several online activities that DAP had facilitated and organized since last year. Next slide. So normally, especially I think in the ISSUP community, a lot of you are familiar with the kind of trainings that we do and the training experience that that we treasure every after training. So last year we had to adapt to that and go to a virtual platform, starting with the 9th training cohort for the criminal justice, as part of the criminal justice system training that we did, 2 virtual courses with the Philippine Drug Enforcement Agency on UTC 4, Basic Counseling Skills for Addiction, and UTC 6, Case Management for Addiction Professionals. So this is actually, this was supposed to be done on a face-to-face format. However, of course, with the pandemic, we had to make adjustments. So some of those adjustments involved blending a lot of the learning strategies of, instead of doing training for 6 hours, you only do it for 2. Blending it with offline activities as well that we enforce for collaborative learning to do with us. So for these courses, we had 31 participants from PIDEA who joined us in this initiative. Of course, this training was supported by the U.S. Embassy INL Manila. Next slide. So apart from this, a lot of trainings are also happened in other parts of the world. Trainings conducted in Maldives and Indonesia, Afghanistan, about 5 countries in Africa, 5 countries from Latin America, to name a few of our initiatives, bringing our reach wider despite certain limitations. Next slide. So of course, to tell you about it, there has not been a standard guide for us yet. So, but at the same time, we had to continue to deliver the trainings and capacity building to as many people as possible, and the projects that we have in line. So we had to adapt to this and you know, consider a lot of considerations involving restructuring our training agendas, adjusting the times, applying alternative strategies to still have that participant engagement, adjusting our group size if it's possible, and working through the challenges of technology and learning. In Indonesia, my colleague Eri has shared with me that they even created video tutorials to accompany their UTC online training. So I think as we implement and run these projects, we learn so much and adapt and apply different strategies as we go along. Next slide. Okay. So this does not come without challenges. One of the major things is our internet connection, especially on some days. You know, it becomes a barrier, but at the same time, it's not a dead end. You know? So it requires a lot of that adjustment and familiarization of the tools, of the platform, and be able to manage that time both for our trainers and our participants for an effective training experience. Next slide. So although there are challenges, there are a lot of opportunities in the use of different strategies and the training experience itself for both our trainers and our learners. We make use of like supporting tools to help facilitate the trainings better, like messaging apps for creating and sustaining an energetic and enthusiastic atmosphere. I think that's one of the really valuable things when we meet together for trainings. It's not just what we learn from the content and the course. It's learning from each other, that exchange, that value that you have from each other. So we make sure to, in a way, recreate those experiences through the use of supportive tools, like videos as well, like doing live playing, making sure that the experience is still high in impact. So far, especially with PIDEA, we've had a very positive feedback on the training that we've had with them. So we also look forward, of course, to that more standardized and formalized trainings that will be available soon, just like what was shared on the first day through self-guided training and trainer-led trainings to be available virtually eventually. Next slide. So another program that we were able to launch last year was our 4 outreach and drop-in centers in the Philippines. This is part of our efforts in strengthening the drug demand reduction, of course, still with the support of the U.S. Embassy Manila. So with the selection of these 4 centers, so this has gone through the process of selecting accredited centers and service providers with the help of course, our partners from DDB, DOH, together with INL, we did panel interviews and virtual facility tours, you know, adapting to how can we be able to facilitate this process and continue on with what we wanted to do even prior to the COVID situation. So the outreach and drop-in centers allows communities to build connections, extend our services to the marginalized populations, provide that information and access to services across the continuum of care, from screening to recovery support, services to our communities in the Philippines from Luzon, Visayas, and Mindanao. So we are in the beginning, just in the beginning of this project. Next slide. So here you can see our virtual way of launching this project. We had our very first virtual launch and ceremony for the 4 implementing partners across the country, namely Ako Ang Saklay in Nueva Ecija from Luzon, CHDXI Outpatient and Aftercare Center for Drug Dependence in Davao City, JJVBMC in partnership with Balay Silangan Reformatory and ODIC in Davao Oriental, and DOH Treatment and Rehabilitation Center in Pototan, Iloilo. So these are our 4 ODIC implementing partners who have been actively working with their respective local government units to help their barangays, their communities have access to evidence-based prevention and treatment practices. So in this event, we had a virtual signing of the MOU, and had that gathering of showing each other our support. So all of these 4 centers are provided with a 2-year operational support, of course, with the help of the U.S. Embassy INL Manila. Next slide. So like what I said, we are in the beginning of implementation of this project because of the pandemic that has been persistently affecting our lives. There had to be a lot of adjustment, adapting to pursue our activities strategically. So here we found opportunities in catering to communities better through really strong linkages and collaborations, active partnerships, using the resources in the community, maximizing the virtual platform, but at the same time combining it with limited face-to-face implementation, from screening to the referral of services, and also making use of even the call and text resources, especially for remote areas. So of course, with that comes all these challenges that are similar to what was shared in other presentations. Next slide. I can hear there's a timer. Okay, so another activity that we've done is we've launched and started the adaptation of the UPC Course 5 on school-based prevention intervention. So we did, next slide. Here you can see that we've started adapting our course materials to be utilized with for the PNP and the PIDEA. So it kind of reminds me also of the dialogue that was said, the needed dialogue between the law enforcement and school prevention on the first day. So this is something that we've started as well. So let me go on just quickly. Next slide. Okay. So, and also outside of the Philippines, there are a number of activities on curriculum development that our DAP colleagues have been busy with and have been doing a lot of pilot testing in the recovery curriculum, revisions to the youth curriculum, a lot of the updating in the universal treatment curriculum and universal prevention curriculum series. An integration of the ICAP credential to the national framework is being done in Indonesia. There's a lot of translation work happening, and also the ongoing evaluation of the child curriculum. So all of these activities are happening as well, working remotely with each other and meeting virtually. Next slide. Okay. So when we couldn't really meet face to face, we found ways to connect here and around the world. So DAP has also participated in activities that our partners and friends in the field have organized, and we're just a part of them. One of these events is the Caring for Children in Response to COVID-19, which was organized by the UNODC Philippines, and also an event done by USAID Renew Health, where we were able to share the child curriculum through their event on community-based drug rehabilitation interventions for minors. Next slide. Okay, so these are other online activities done by DAP in other parts of the world, monitoring visits for centers in Afghanistan. So these were done through the virtual platform as well. Again, a lot of adaptation work in the curriculums, automating of the UPC core course, among many others, and also ongoing member country consultations in Afghanistan, Maldives, Sri Lanka, and also the Philippines, which took place last year as well. Okay. Next slide. So in the Philippines, we do continue to collaborate, to learn through the virtual events and meetings organized by our partners, and really continue to build our connections for new projects. In fact, there are a lot of exciting new project activities that we can look forward to, that we can hopefully confirm, launch, and share with you when that is possible, hopefully very soon. Next slide. And of course, to share with you, so we've been doing all these activities across here locally and across the globe. With the pandemic, it did hit us like a storm, catching us off guard and unprepared. But these three things are our takeaways. One is that we're stronger with collaborations. Just like a glimpse of the first day, none of us is as smart as all of us. Second, despite isolation, we increase our reach despite being isolated from one another. And the third is, I think, in a way, we are recreating our experiences in the field in this new world, adapting throughout the times. So lastly, last slide. Yeah. So thank you to everyone for ISSUP Philippines for this opportunity. Our social media pages are there for you to follow if you have not. Thank you again for allowing us to share our activities with you. Thank you and good morning.
Thank you, Ms. Therese Castillo from the Colombo Plan Drug Advisory Program. And now we go to Dr. Gilda Gayle Gomez from the Psychological Association of the Philippines. Dr.
Okay, good
Hilda, can you
morning.
please turn on your audio? Thank you.
Okay, can I be heard now? Sorry.
Yes, thank you. You're being heard now.
Okay, thank you. Sorry. Good morning, everyone. So let me share with you this resilience program developed by the Psychological Association of the Philippines, which we call Katatagan Online. Okay, so what motivated us to do this? So we recognized that there is another crisis behind the COVID-19 pandemic that concerns our mental health. Studies have revealed that this pandemic may affect people in so many ways. A lot of people have reported, to name a few, difficulty sleeping or eating, increase in alcohol consumption and substance use, and worsening chronic conditions. People are already reacting to the implications of social distancing and recession in economy. And the challenge is that there is a problem accessing mental health services, treatment, or intervention because of the restrictions. During this time of uncertainty and fear, mental health issues and substance use disorders will be magnified. Not to mention that epidemics have been shown to cause general stress across population and may lead to further mental health and substance use issues. So who are vulnerable? Studies show that this may greatly affect those who have been infected with COVID, including their families. This will also affect older individuals and adolescents. Add to the stress of adolescents is their adjustment to online learning. Frontliners are prone to experiencing burnout and can consequently suffer from mental health issues, including depression and substance use. Job loss is associated with increased depression, anxiety, distress, and low self-esteem, and may lead to higher rates of substance use and suicide. Persons with substance use disorders who might already be in the process of recovery might experience lapse or relapse, and people with mental health illnesses may manifest worse symptoms. The number of people with mental health concerns begin to balloon, and so the need for a public health perspective on mental health. To date, the ratio of mental health practitioners is 3.43 for every 100,000 Filipinos. Specifically, there is just one psychologist for every 90,000 and one psychiatrist for every 175,000 Filipinos. 75% of our mental health professionals are in major cities. Only very few or none at all are servicing the rural areas. Majority of mental health services are not accessible and not covered by health insurance. And even as the mental health law mandates for services to be delivered in different settings, there is still a big gap in evidence-based mental health interventions in the Philippines. Given the reality of this pandemic, there is a greater need to understand the psychosocial needs of these people who need help. Thus, the Katatagan Online. So Katatagan was first developed to assist survivors of Super Typhoon Haiyan in 2013. A group of 30 psychologists from all over the country came together to design this. At the same time, the psychologists were also disaster responders. It was pilot tested first among college students in UP Tacloban and then ran to community members in Samar and displaced residents in Tacloban. Katatagan follows this design provided in the mental health and psychosocial pyramid that offers ways that we can enable well-being amidst disaster situations. You can see here that not everyone will need psychosocial or psychological help, but the basic help that people will need is fulfilling their basic needs. To quote Dr. Regina Hechanova, our team lead for this program, mahirap maging matatag ang gutom at may sakit. One tangible help that our government and other agencies can do is to make sure that people who need this kind of help are supported. In the next level, those who are experiencing mild distress may benefit from the support of the community and their families. Those with mild to moderate symptoms can be supported by paraprofessionals through individual, family, or group interventions. The highest level in the pyramid are those with severe distress, and these are the people that we need to refer to trained professionals. Katatagan was designed to develop resilience skills from among survivors with mild to moderate distress symptoms. These people were affected emotionally by being anxious and fearful. Cognitively, there's the experience of guilt, problems in concentrating, and a general feeling of hopelessness. As mentioned earlier, there are also those who have difficulty sleeping and resort to alcohol and drug use to manage their stress. A lot also reported pains in their bodies and frequent headaches. One's spirituality has also been tested. There were reports that people question God and also think that disaster is a punishment from God. The Katatagan follows this model. So it allows participants to go through 6 modules. For each module, they learn skills towards resilience. The first session is on kalakasan, or cultivating strengths. Participants are asked to remember those times when they were faced with challenges and were able to get through them, drawing on their own strengths, support from others, or even through one's faith. In the end, the participant recognizes his self-efficacy. The second session is on katawan, where participants see the importance of managing physical reactions to also manage their stress and anxiety. They are asked to identify healthier habits and are also taught skills in meditation, mindfulness, and relaxation. During crisis, negative emotions and unhelpful thoughts may impede one's ability to recover. In the next session on Kalooban, participants are made to be aware of their own unhelpful thoughts and understand how one's thoughts influence their emotions. Here, they are taught reframing skills to do away with the unhelpful thoughts and take a new perspective in looking at things. During crisis as well, routines may be disrupted. Anxiety can change patterns or behaviors that may affect our quality of life. So in the next session on kapaki-pakinabang na gawain, participants are asked to identify positive and helpful activities to help improve their mood and slowly move towards regaining a sense of normalcy. In the fifth session, Kalutasan at Kaagapay, participants identify pressing concerns and possible solutions. They are asked to focus on those concerns within their control. We Filipinos tend to problematize even those things that are beyond our control, and that increases our anxiety even more. So participants are also asked to identify possible sources of support, whether individuals, groups, government agencies, or private institutions. Knowing that there are people or groups that we can run to for help may already alleviate one's anxiety. The last session is about meaning making and planning ahead. Participants are made to find the meaning of these experiences, how these experiences changed them for the better, and reflect on how these lessons may be applied in the future. In April, we redesigned the Katatagan Resilience Program. It was resurrected and was brought online to help those affected by the COVID crisis. It was run in synchronous small groups using Zoom since May 2020 with about 60 classes and about 500 participants. Participants have come from all over the country from different groups. There were students, frontliners, parents, workers, displaced employees, and a lot more. It has a website where people can go for self-help, enroll in our resilience classes, or look for links to mental health professionals. In the website, you will see this. So you're going to find self-help approaches for those who may not need to enroll in the resilience classes. Then there's a link to the resilience classes. One gets to choose his class schedule. It uses a blended learning approach, and 2 facilitators are assigned to small groups of about 12 people. And then the link to mental health services. For the initial run of the Katatagan Online, we did a pilot study which yielded to the following results. You can see here increase in our participants' mindfulness, acceptance of their situation, in their seeking for social support, spiritual support, and active coping. There was decrease in their experience of depression, anxiety, stress, and a general feeling of a better well-being. So people who accepted their situation, people who practiced meditation, those who had spiritual support, and those who problem solved tended to be less stressed, less anxious, and less depressed, and reported better well-being. What do our participants have to say, and what did they learn? So according to our participants, they were able to learn new ways to manage their stress, and that they realize that there can be peace amidst chaos. They also learned that mindfulness can be very relaxing. They have learned how to control and reframe their negative thoughts, and that through problem solving, they are capable to find solutions to their problems, and that they can actually let go of problems that they have no control of. And on top of all, they were able to also help others. So just recently, we have launched the Katatagan Online Internship Program. First, to address the need to reach out to more Filipinos interested to participate, and to respond to the desire of some practitioners to assist in the program but are not yet trained to deliver it. So we are happy that there are more and more practitioners who are willing to volunteer and help address the mental health concerns in the community today. The Katatagan Online, on the other hand, continues to be evaluated so that we could also improve on our services and make sure that we are able to respond to these concerns. After all, we are stronger together. Thank you very much.
Thank you very much for that Katatagan presentation. I think I'd want to volunteer and be trained, Dr. Gilda Gay. Again,
Sure,
we
Pod.
have two first names, Gayle or Hilda, which do you prefer?
You can call me Gail. Gail, sir. You
Okay,
can call me Gail.
sige, Dr. Gayle, thank you very much for that presentation of Katatagan. And now we go to our last but not the least presenter. Well, every journey has a story, and this story we believe we would like to focus on, especially for families who are who are in the process of recovery during this pandemic. So we would now like to call on Hydie M, recovery experience during the pandemic.
I'm sorry, Heidi, can you please turn on your video and your microphone? We can't hear you and see you. Thank you.
Please bear with us. Our next and final speaker, Miss Heidi, is trying to reconnect because she has lost connection. Thank you. Okay. Hi, Malene. Are you online? We're having a bit, we apologize for that. We're having a bit of a difficulty in terms of, I mean, Ms. Heidi trying to reconnect. So what we can do perhaps is just go ahead straight away to the Q&A portion. First, Malene, I'm really, it's so rewarding to be part of this conference. Congratulations on the clarity of the shared experience and evidence-based insights and inspiring takeaways that have been shared with us by Mayor Vico, Dr. Miriam, Ms. Giovanna. Very instructive, in fact, even if she's not live, Ms. Therese or Ms. Coco, of course, of Colombo Plan, and just now, Dr. Gayle. No? And Malene, it's so gratifying to really take a look at the questions and the comments. Now, allow me to start with the affirming comments from Senor Alberto Acosta. He says, excelente y muchísimas gracias. No? So what we can say is, eres muy bienvenida, Senora Acosta. Very good webinar coming from Kuldeep Shukla and Dr. Kamal, who has been with us since day one, like a good number of our participants. He says, salute to ISSUP Philippines and the global ISSUP family. And thank you for facilitating this important discussion coming from Mr. Giao Tet Do. No? Malene, from your end, what questions have arose so far? Perhaps we can call our panelists at this point.
Yeah, maybe we can call everyone. Oh, I see Heidi is coming in.
Oh, okay, that's great.
Okay.
So we can give the floor to Heidi
we don't
first.
want to miss Heidi's
Yes,
talk.
absolutely.
Okay,
Thank
Heidi,
you.
I hope you have your what's this mic is on. Okay, thank you. See.
Hear me now?
Yes, we can hear you.
We can. Yes, we can.
Okay. Good day to all. Thank you for inviting me to share my recovery experience during the 2020 pandemic. A long-wanted birthday wish was granted on November 11, 2019, when I celebrated my birthday in a place where I truly experienced the very essence of my Christian faith. I went on a pilgrimage to the Holy Land with my mother, auntie, and some closest friends. In my 14 days of pilgrimage, I had only 2 prayers, which I recited repeatedly. In all the churches and sacred sites that we visited, it was for my eldest son and my youngest sister who was abroad. And my only prayer to the Lord was, I offer to you my son, and he is your son too. Please grant him wisdom to do your perfect plan for his life. And now, here is the start of my journey. So on January 15, 2020, after a 4-day vacation in Siargao with friends, my son came home totally different. He was not his usual self. He was talking and expressing himself freely. He was timid and shy for 24 years at home. Di ko na kilala ang sarili ko. I don't know myself anymore. Gusto ko lang happy kami lahat. All I want is my friends to be happy. He was totally confused and disoriented, and I know and I felt something was wrong with him. Then my sister arrived from abroad on January 12, 2020. She is also an SUD and a person under recovery. I learned later that my son confided with my sister his fears and admitted that he was using drugs since he was 15 years old. He wanted to stop and needed help. Now, as a solo parent, I was torn to pieces. I could not bear to see my son very vulnerable. When it comes to my son and his problems, I am at my weakest. Should anything happen to him, I would not be able to handle them. I was still in the state of denial since all I knew is mother knows best. I was blaming myself of what had become of him. Honestly, just to share with all of you, while he was on treatment, I too was on treatment. I went to see a psychiatrist friend for help. Going to clinics during pandemic was both a relief and an agony of complying with health protocols. I had feelings of guilt and anger to those who were responsible for his addiction. But one thing I was sure of was that I was not angry with my God. My doctor friend was a big help, and the psycho and family therapy sessions too. These truly unexpected and sad experiences have helped me realize the power of awareness, acceptance, and actions for my recovery and my son too. For then I knew that it can be like any disease that can be taken care of with proper attention, medication, and love. The 3 A's, awareness, acceptance, and action, made my journey more engaging, real, and was working perfectly. All of this happened during the COVID-19 pandemic. The turning point of my life was on February 2, 2020, when my siblings told me that I should not be on the backstage, but in front, to be strong and journey with my son and to stand for him. Honestly, I was afraid if I can do it, but a decision has to be made. It was a big leap for both of us. After a while, my son realized that it is better for him to be in the behavioral center rather than in a psychiatric center. And me, his mom, who was simply on the side watching, is now the pilot of my son's recovery. I have to work on myself so that I can effectively work with my son. I started to follow the psychotherapist to-do notes, which includes the following: have my daily dose of happiness at the start and end of the day, to trust fully and genuinely, to lessen my superwoman personality dynamics, try to assign or delegate to others, to acknowledge my feelings, evaluate the reasons behind the feelings, and come up with the solutions to lessen the feelings. And she told me a formula to lighten my load. I should imagine myself, I'm inside a Zorb. I think you know what a Zorb is. It's a transparent big ball in which you can see everything around you, but you cannot hear them. For me to worry less. Suddenly, there is a shift in the way I run my daily activities, my preferences in what I thought I was very good. I had to pause since my physical health has been affected too. And the pandemic was real for me, which when I have been quarantined for 9 times for having been either a primary or secondary contact of a COVID positive. It was a torture just to be in my quarantine room, but all I had in mind was I am okay and I will be okay. It made me to trust more and move forward for my wellness. The pandemic and the program were instrumental for him to finish the remaining subjects to get his college degree. Despite the loneliness of not seeing him, I was consoled that he continued his studies through online classes, and the case manager helped him coping up with 5 major subjects. I became lonely, but weekly progress reports from the case manager sometimes delights and sometimes frightens me. But my son made it, and he was given a certificate of completion that has made him proud of himself. All the more me, his mom. After 3 months, we had our first family therapy. It was both scary and happy since we could see him again. It was scary because we're not used to communicating openly to each other. We were facilitated and it went fine. And since it was the height of the pandemic and observing health protocols, we were able to see each other only through virtual meetings. Seeing him made me anxious. He was gaining weight, but I have to trust the program and trust him. Fear and anxiety was my companion. I started to look forward to his reintegration program so we can bond and be a family again. 7 months later, in August 2020, my son proudly graduated as a person under recovery. All my family members were present despite the threat of COVID-19, and we were there 100% supporting him. Undoubtedly, the proudest person that day was me. It was a different challenge during the aftercare plan. The Zoom meetings were the only way to communicate with each other. During those meetings, he can put the camera off, and who knows what he was doing on the other side. I was afraid again. Is he putting to practice what he has learned? What about a possible relapse? I still engage in family day activities sponsored by the center. The center gives talks to help the families to live fully with their addicts. Since he left the center, and for my peace of mind, I do surprise drug testing for him. He is now completing his on-the-job training, and God willingly will graduate in June, his second graduation. The pandemic months sustained and empowered me to go forward and believe in the 3 Ps, namely prayers and my personal encounter with my God. It is being in the moment, being present, being open. I have my own way of praying, and praying for me is like birthing, and it's worth all the love and effort I put into it. Every time I breathe, I pray for our recovery as a family. Prayers had wonderful effects on me as they slowly removed my fears, changed my heart, healed my wounds, and I have forgiven myself, my son, his alcoholic and drugging friends, and it gave me psychological comfort, which I needed most. I soak my recovery, my sons, and my family too in prayer. Every prayer is a celebration of love, inner joy, and peace. People, a lot of them who in good and in bad were there for me and my son. My family who helped me in all aspects of my journey. My church and Bible study communities. My best friends and the people in the center and his case manager. the other SUDs and parents whose life testimonies were helpful in my healing, but most especially to my mother, who has always been my strength, my sister for not giving up on us, my daughter who is with me and never left me, her quiet smile telling me that this too will pass. She is an angel from above. And to my husband, whom I know journeyed with us, watching over from heaven and celebrating hope after the rain. Patience, patience in waiting and enduring without getting worried, being calm even when things are uncertain. Patience has taught me to stay faithful no matter what the situation is, believing in our journey to recovery. Patience to understand him in times of disagreements at home, giving him the chance to see his own transformation. As for me, I can be myself with the promise to keep him in my heart. The journey is not over, yet I know that addiction is not something that can be fixed in months. It can go on as long as a lifetime. Learning to love him and showing that love in so many different and creative ways. I have learned the roles and rules and try not to be an enabling mom. The journey, as well as this pandemic, has taught me to silence my mind and to focus on what is essential. To silence my mind, to simplify the desires of my heart and the serenity of my soul, and to be at peace with myself are my 3S. Trusting in God that I, my son, my family, will become better persons today than yesterday, doing his will and his perfect plan. I strongly believe the letter PASS had made an impact in my life, and I can have the courage to say that I have passed my journey with thanksgiving in my heart. Thank you for listening to my lived experience, and my attempt to do the evidence-based tenets of ISSUP. I realize now how conceptual recovery framework guides practical experience. This unique experience happened in the context of family, support networks, and the pandemic. Looking back to the double challenge of encountering the reality of my son's substance use disorder, which I shared as a pro-dependent. Now, I observed and practiced the ability to self-manage and self-regulate my emotions and behavior. My choices, values, and preferences have shifted as recovery progressed during the pandemic. There are basic life skills I have learned, practiced with regularity in spite of the limitations imposed by the lockdown. I optimize the leverage connections with substance use professionals, close relationships, support networks, and community. And finally, emerging from darkness, my positive sense of self were augmented by drawing on my strength and faith in a higher power. Thank you, and God bless us all.
Thank you.
Thank you,
so much,
Hydie.
Ms. Hydie.
Yeah, thank you. I guess we can call, Susan, do we call everyone, the speakers to
Yes.
come in so we can ask the questions?
May we invite all our speakers, from Mayor Vico, Dr. Miriam, Ms. Therese, Dr. Gayle, of course, Hydie, please stay with your camera on. Thank you. That was most inspiring.
Yeah. Thank you. I guess everyone is coming in. I'm just sorry to hear that our Mayor Vico cannot join us anymore because
Oh.
there are questions for him,
Yeah,
Susan. But maybe
absolutely.
before I go to the first question that we would want to discuss this morning or this afternoon. Somebody said Pasig's prevention, preventive education plans and anti-drug support activities are best practices in the community as led by Mayor Sotto. Other LGUs may use this benchmark in strengthening the country's campaign against illegal drugs. Hats off to Mayor Sotto. Okay, so anyway, there's a question here, and maybe Serge Musni has been asking these questions from this question from day one. First speakers were able to answer part of it. So I'm going to read the question, okay? Alcohol is the next option to drugs among other forms of addiction, which is still a mood-altering substance through though legal. Shouldn't we also be focusing on the addictive behavior and the propensity that the addiction or addictive behavior can transfer to any form of drug of choice, rather than focusing just on the illegal substance? Anyone? Of course, this is a question to anyone who wants to answer. I think he is more focused on the other substances. Yeah. Yes.
Malin, what is he trying
Yes.
to ask? Alcohol as the entry to other point of other drugs, or I cannot seem to understand. I'm sorry.
No, because I think what he's trying to say is that our talk is about illegal drugs, during this pandemic, people going into treatment because of the use of illegal drugs. So he's now saying people are shifting to other addictive
substances,
chemicals, whether it's alcohol or addictive behavior. So
Yeah.
won't we also focus there? Something like that.
Yeah.
Anyway,
it's
Dr.
true.
Miriam?
Yes. I would just like to validate his observation that many of our clients, or I would say PWODs, are actually shifting from illegal drugs to alcohol. And because it's legal, while we know it's not really safe, the fact that it is legal makes people think it is all right. So maybe we should give more attention to this, especially among us addiction professionals, because many of them also became considered suicide as a temporary solution, a permanent solution to temporary problems. We know for a fact that many of those of the suicidal cases are actually, have histories of alcohol use or using alcohol for that matter. So in terms of attention, yes. But I would also like to say that this has been curtailed a bit because gatherings are not allowed. While in the past, people would, we Filipinos basically are social drinkers. So, yung mga tambay, they would usually, drink, especially in rural areas within public notice and small stores and all that. But it has been curtailed a bit because of the curfew and then the lockdown and the
Thank you.
health protocols.
Thanks so much, Dr. Miriam. Thank you for that perspective. No, perhaps Ms. Therese and Dr. Gayle would have also their own perspectives on that, especially now that it's not just face to face. There's already inuman, on Zoom. No, Ms. Therese and then Ms. Gayle after. And kindly, please keep your responses short. Thank you.
Thank you. Yeah, so I think the question or sort of comment is also because we're hearing a lot of focus on the illegal substances. But I think with what everybody learns with our UTC courses from the Colombo Plan is that legal or illegal, they are all substances of abuse. And while there is a need to focus on addressing the alcohol problem, I guess it would still be more of the impact of these substance use on mood, affect, behavior, and thinking on a general scheme. But definitely having more initiatives to address alcohol specifically would be great in the future.
Excellent. Yeah. Did we lose Dr. Gayle? Is she still?
Yeah.
Yeah, okay. Malin, you know what? We actually only have about 5 to 7 minutes left. Would you like to go to the other questions that might have been asked earlier on that you captured?
Yeah, it's just that this question was also asked yesterday. I don't know if it's the same person asking. It's about people dying inside treatment facilities in the hands of supposedly professionals sworn to treat or care for them. When will treatment facilities be truly regulated to ensure professionalism and proper rehabilitation services? This is from Mr. Nobleza. So yeah, that's the I think that was raised yesterday. But anyone in the group, do you have any idea, anything you have in mind about these incidents happening in different facilities? Yeah.
Yeah. Heard of it.
Therese, you want to say something?
It might be monopolizing the session. But yeah, I also heard that question yesterday come up. But of course, as Colombo Plan, in terms of regulation, that is not within our grounds. But I think it would be most appropriate to be answered by yesterday's panel on the national level. But of course, I guess for us, from the Colombo Plan Drug Advisory Program standpoint, it is to advocate and always make sure that we are able to deliver the evidence-based practices and be according to the international standards of care, just like what UNODC has shared and all of the partners have been sharing and advocating. And of course, having these unfortunate incidents, actually, I would think if it's not reported, then it will not be taken action. So I think it's also there are a lot of factors in things that are happening in centers, and hopefully people are able to report them accordingly. Just like I think like what was shared yesterday with our national agencies from the DDB, the DOH, I think they can be able to take action on this upon like formal reportings and complaints, which hopefully people.
Thanks so much, Therese. No, didn't you notice, Malin? No, as we look at all the questions, there's a lot of affirmation to what was presented by Mayor Vico. No, they say it's very holistic. You know, it takes into consideration different levels. It's highly inclusive. You know, in spite of the diversity of points of view of members of society. In fact, I'd like to. I'm sure Ms. Hydie had the opportunity, to listen to him as well. And I was wondering, Hydie, and thank you so much for that personal sharing and even putting it in the framework of recovery. No, what has been your experience so far, in terms of the kind of support, that you've been receiving from different support agencies and the like?
First of all, my son went into a private treatment facility, and I was very delighted with on how they manage my son, and of course the one I've made mention that what really helped me most are I also came across this community program within the parish. So my son had some sessions with some of the addicts with the very selective group, and a spiritual director was also handling him. So I think there was a holistic approach in his recovery, and I'm thanking the private behavioral center who handled him, and of course the Christian, the Catholic group who was also handling his the spiritual aspect of his recovery. So there, I got a lot.
Yeah.
Yeah.
Thank you, Hydie, and of course with the presence of experts and professionals, like present company included. Malin, perhaps we can wrap up by asking them the silver lining question. Would you like to ask our panelists that?
Yeah. But before I do that, though, like you were saying, I really want to affirm everybody. It was really, in fact, while listening, I didn't want, like, I want to take a break or something. I didn't want to miss anything. So thank you for all your presentations and the sharing, of course, of Hydie. So anyway, I'd like to ask each one of you, any silver lining, like that you, I know some of you already said that during the presentation, but right now, top of mind, what would
is
be really
one,
for you the top, just one silver lining
in one sentence, in one sentence. Yeah. Thank you. Who'd like to start? Maybe let's start with Dr. Gayle, please.
Yes.
Hi, good morning again. We've been running the program for 9 months now, and we are still so amazed and overwhelmed with the support provided by mental health professionals. These are volunteers that we're working with right now. So it's just overwhelming that they're giving their services for free to be able to help others during this pandemic. Thank you.
Thank you, Dr. Gayle. Yes. Anyone who wants to go next? Dr. Miriam, you want to go next?
Yes. I would say people are more educated, more informed that SUD is a mental health issue. And so we have more service providers now to give the needed help, while at the same time, those who are our PWOODs are also seeking help, realizing that they need help.
Okay. Thank you, Dr. Miriam. Yes, Therese?
Yes, so I guess one silver lining across all these 3 days and also this morning's very fruitful presentations is that we have many allies in the recovery community in prevention, treatment, and recovery, and just being able to enforce and continue this systems approach. I think we will be able to surpass all the challenges that we have and be able to carry forward, carry the message to the entire recovery community with all of us working together.
Thank you.
Thank you, Therese. And Hydie?
Yeah, I'll just give a quote. A diamond is a piece of charcoal that handles stress exceptionally well. So, and again, I will focus and concentrate on my self-happiness. So that I think for me is my self-lining. That's my priority, my self-happiness.
Thank you. Excellent. Yes. Most grateful, Paul. We're really most grateful to all our day 3 plenary speakers, Mayor Vico, Dr. Miriam. We're very honored. Miss Giovanna, even if she's not with us live, Miss Therese of Colombo Plan, Dr. Gayle, and Miss Hydie. And of course, to our very active participant attendees, a lot of comments that we're not, I'm afraid, not able to capture, as well as questions, especially for Mayor Vico. So papadala po namin sa inyo, Mayor. May I now introduce our rapporteur who will share his integrative observations and insights on what has been presented by our 6 plenary speakers. Professor Armand Crisostomo is a graduate of the University of the Philippines College of Medicine, cum laude. He proceeded to complete training in general surgery and colorectal surgery at the Philippine General Hospital, or PGH. Afterwards, he underwent a rotating fellowship in colorectal surgery in various hospitals in the UK and the United States. He is currently a full professor and vice chancellor for research at the University of the Philippines, Manila, where he has previously recently held a number of administrative positions, the most significant of which were Assistant Director for Health Operations at PGH and Associate Dean for Planning and Research at the UP College of Medicine. He has also, in fact, served as President of the Philippine College of Surgeons, among many other professional organizations he leads. He has completed 80 publications in the areas of his specialization and has actually spoken in many speaking engagements globally. Currently, he serves as chair of the PCS Council of Surgery Specialty Boards and the UP Manila Technical Working Group on Addiction Sciences. Professor Armand Crisostomo. Doctor, please.
Good afternoon to everybody. You may be wondering what a surgeon is doing in a forum like this. My only claim to fame is that I'm currently heading the technical working group of UP Manila that deals with addiction sciences. But I cannot claim to be a content expert on many of the subjects that our speakers were able to discuss. Okay, but let me give my comments on the presentations given and a little, maybe in some areas, provide some recommendations so that we could be able to move forward this common advocacy that we all share, or a family of substance abuse advocates. Okay, so certainly it was exhilarating and gratifying to be able to bear witness to the many myriad of interventions and programs that so many people who believe that substance abuse management could be made better in this country and in the rest of the world have proposed. However, since I come from an academic environment and which is essentially very research based, I'm a stickler for the importance of determining the effectiveness of these interventions by using appropriate quality measures or measures. Okay, not too many of those who presented their experiences, you know, aside from having people after holding a project, you know, so happy, holding hands, singing kumbaya, you know, it's best that we have an assessment of more objective assessment of whether our programs were really effective or not. And I think only a few of those who made the presentation, maybe like Gayle, submitted a pre versus post intervention information or data. Because I'm a firm believer in the quality intervention or quality improvement guru Peter Drucker, who said, in order to improve, we must first measure. So I think we need to, for any of the projects or programs we wish to implement, we need to develop the necessary measurement tools to determine whether our programs were really effective, in what areas did we not do as well, so that we could lead to improving these programs further as we roll them out to all the necessary stakeholders. Okay, and maybe some of you had actually such measures of attainment of the goals. It would be, you know, it would be, I think, better in next time you're given the opportunity to present those pre versus post intervention data as well. Okay. Secondly, I will deal on the issue of the use of the online platforms. I think this is one of the major blessings and silver linings that this pandemic has brought us, because it has really changed the way we communicate, the way we educate, and the way we influence each other. I think, for example, this ISSUP meeting could not have been able to bring, together participants from many countries, resource persons. Had we had the old-fashioned face-to-face, we would have to fly them over to Manila, billet them in a hotel, etc. Not too long ago, we had a virtual graduation in UP Manila, and we were able to save so much in the events having to reserve at the PICC. But so that is the blessing and silver lining, which I think we, for the most part, we have been able to maximize as well. And however, there is a little difficulty in applying, as I mentioned earlier, tools of measurement when we're having things online. But of course, there are adjustments in the modality so that it becomes friendlier to the participants in, for example, a Zoom meeting. Most people at the end of the Zoom meeting, they're a little lazy to fill up, measurement instruments or tools. So you'd have to be a little creative so that along the way you can take polls, etc. So just to find out whether your audience is learning something from the online platforms that you are using. Second is that, and I think this has been mentioned by quite a number of those speakers, one of the limitations of the online platform is it does not reach the most vulnerable population. And that is the poorest of the poor who absolutely have no access to the internet. And they're the ones who are also exposed to what they see as a hidden, hidden curriculum. No matter what we say about avoiding drugs, not touching it, it's difficult when they live in a very squalid, very crowded environment, and then they see actually, drugs being, marketed right in their very neighborhood, very crowded neighborhood. So I guess that tells us that we have to partner with other agencies who are able to use online and other platforms so that we could get our message across. And two examples include the Department of Education, which is using the online platform to be able to reach out to students at various levels. And secondly, even partnering with the Department of Health and the local governments in terms of the contact tracing that is being done in up to the barangay level. No? So, for example, aside the contact tracers can also be the one trying to push the community-based drug rehabilitation programs as well. The other shortcoming, I believe, being an educator as well, of the online platform is that it is difficult to demonstrate and teach what we call in education as the soft skills. Teaching empathy, teaching compassion, and it was highlighted in one of the presentations, teaching affection. Now, sometimes it is one of the best ways to communicate that to our learners is the simple touch of the hand, the simple handshake, the light hug that we extend to each other to show the sincerity of our intentions. And that is somewhat difficult to do since face-to-face interactions are not allowed at this particular time. But, communicating compassion, empathy, or these other things that we call soft skills have been shown to be crucial to the success of many interventions and programs. Thirdly, is that while the online platform and social media has revolutionized our ability to educate and inform people, there is a negative aspect because there are competing messages on the internet as well. So if there is a way in which we can inform, there is also a lot of misinformation out there. Okay, classic example is what is happening to the United States. The country has become so divided because different sides are believing in different data or different information. They have different versions of the truth. And that is going to be one of our major challenges because, like, for example, let me show you the online platform as we use it to our advantage to educate and inform people is now being used by a lot of sectors to push drugs as well. You know, the last time I just listened to the news this morning, they confiscated 1 kilogram of marijuana to a group of people who were selling it, and they were actually setting up the deal through an online platform in social media. And of course, while there is an economic dislocation, people have lost jobs, and but the internet has opened itself to child pornography and victimized and exploited many of our young women who now use that as a platform to generate income, giving them money to secure illegal substances. And lastly, of course, I think we all have to get together, all the players in this. We need to have a common message to everybody. Okay? Sometimes, while we are partners, the partners are sending mixed messages to the community, and the community gets confused on whom to follow. Let me use as an example the term war on drugs. When you say war, it always connotes something aggressive and something violent. The war on drugs was actually taken from in the United States when crack became, very common in the 70s and 80s, and this led to, literally a war, leading to many arrests and overcrowding their prisons facilities. The term war on drugs continues to be used by a lot of our partners in law enforcement, and of course, that message sometimes is taken too literally. So maybe if we can develop a more common slogan compared to the war on drugs. Thirdly, I think all our interventions, it was really gratifying to have everyone share their best experiences or share best practices. But before we adopt this to the local environment, we must be aware of the cultural nuances in our respective societies. Something that works in one country may not necessarily be effective in ours because of our cultural nuances. Let me give an example again. Our neighbor Vietnam was cited as having a lot of success in battling COVID compared to us. We were very low, and yet we're not. Vietnam was not any richer than us. Vietnam's success can be attributed to the fact that when in contact tracing, in Vietnam, it is culturally acceptable to actually squeal on your neighbor and tell them, oh, this guy has symptoms. Okay? In the Philippines, because of our cultural inclinations of pakikisama, etc., you cannot do that. You cannot squeal on your neighbors because you yourself will be ostracized and you yourself will be
Dr. Armand?
stigmatized. Okay, yes.
Yes,
I'm about to end.
may we request you po to wrap up? We're running out of time, sir.
Yeah.
Thank you.
And my last example is, of course, that listening first. It's very nice and it's all very good. But let me tell you again that in Asian cultures, most family structures are still very authoritarian. And therefore, there is really a lot of, going to be challenges in implementing, parenting styles that are less authoritarian in nature. Okay? So that's just my message. We have to make sure that the things we adopt are culturally adaptable. Thank you.
Thank you, Dr. Crisostomo. May we call on the all the panelists who are present still at this moment to turn on their cameras, please? Thank you. We would like to give everyone a certificate of appreciation presented to in grateful acknowledgement and appreciation for having served as resource speakers during the ISSUP Philippines pre-conference event, Emerging Realities in Prevention, Treatment, and Recovery, given this 29th day of January 2021, signed by yours truly as Board Secretary and our President and Chairperson, Therese Castillo. Thank you all so much for your wonderful and very enriching presentations. I'm sure everybody is going to come home very full of knowledge and learning in applying for their practice to help others. Thank you very much. And now we go to our very strong supporter for the closing remarks, a Juris Doctor and the Country Director for the Bureau of International Narcotics and Law Enforcement Affairs, INL, U.S. Embassy Manila, Ms. Kelia Cummins. Kelia, please. Crisostomo.
Kelia, your mic is off. Kindly unmute. Could you try it again, please? Have you unmuted Ms. Kelia?
Ms. Kelia, are you plugged in on? Yes? Yeah, we really can't hear you. You do speak Chinese and Mandarin and but I wish you had, we know sign language also.
Or maybe check, Miss Kelia, if you have been plugged in earlier to another, what's this? That's why you have not, you don't have the sound now here in this platform. Maybe you were plugged in on another, or you were talking to someone earlier using a different platform. Oh, okay.
Because
Perhaps
Olivia's
while we're fixing that, maybe call on our chair and president, Chief Castillo, please. And Olivia and Kath will try to fix the technical, if it's at our end, which I surmise is not. Chit, please.
she also does not have sound yet.
Okay, there you go. Can you hear me?
Yes.
Can you hear
Yes.
me?
Yes, yes, we can.
Okay, so I'll go first before Kelia. So just very brief closing remarks. So how time flies and our 3 days is over, and I'm beyond grateful, overwhelmed with how just about a month and a half of preparations can turn out to be as good as this one. We've had so many affirmations and really beyond grateful. This, of course, wouldn't be possible without the ISSUP Board of Trustees' unwavering support. That sometimes I know they want to kill me already. But seriously, thank you. Thank you, Team ISSUP. To our partners, INL, US Embassy, Kelia, and Giovanna, you guys are the best. And not to forget, also, of course, Colombo Plan, drug advisory programs, Nathalie and Therese, for our much needed financial resources. To our ever faithful partner, the DDB, the Dangerous Drugs Board, Secretary Cue, and of course, Doc Benji, who is always just a message away for anything and everything. To our esteemed panelists, too many to mention at this point, who unselfishly share their time and effort to share their thoughts, perspectives, and experiences. To our 3 rapporteurs, you guys couldn't have done a better job. We know it was a challenge to summarize in 10 minutes all the presentations, but there was brevity and succinctness. Also, Olivia Cruzan from Washington, who has been silently supporting us. And we saved the best for last. All this wouldn't have been possible without our 2 special ladies, our back room. Olivia from Germany, she had to stay up at 3 a.m. for us for 3 days. And our very own Kath de la Cruz, for their resourcefulness, creativity, diligence, patience, and more patience. I can't thank you all enough. We're blessed to have you all as part of our journey. Maraming salamat po. A little bit of some announcements. Please watch out for details of our upcoming second national conference in June 2021. As things are still quite uncertain, we are still looking at different options on how we can best organize our event. But for now, what we have confirmed are the number of training tracks to be offered, a total of 8 tracks, 2 basic universal treatment curriculum and 2 advanced universal treatment curriculum, 2 universal prevention curriculums, and 2 universal recovery curriculums. So we have 8. We hope to provide more details as soon as we confirm what best platform we can use by June. The journey of ISSUP Philippines is full speed ahead for 2021. We have great many opportunities, but also greater challenges. But with your involvement and participation, we can all make our journey together fun, exciting, and meaningful. We are one in purpose, one in action. So thank you all very much. Keep safe and God bless us all. Mabuhay ang Pilipinas. Thank you.
Thanks, Chit. No, we don't want to kill you. We want you to live forever. Now for our deal, Miss Kelia, welcome back.
Let's see, can you hear me now?
Yes, very well. Thank you.
Okay, perfect. I'm not quite sure what happened, but I'm so happy that you're all able to hear me. And I'm very grateful for this opportunity to address you all. So good afternoon again. I am representing the Office of International Narcotics and Law Enforcement Affairs from US Embassy Manila. It was really great, a great honor to be with and view all of the presentations this week. I would like to acknowledge the speakers who joined us today, Mayor Sotto, Dr. Miriam Cue, Ms. Giovanna, Campello from UNODC, Therese Castillo, Gilda Gomez, Hydie M for that inspirational talk, and of course our moderators. We have had such an incredible and productive 3 days. INL extends its gratitude and congratulations to ISSUP Philippines for making this pre-conference event possible. This is indeed another milestone for the Philippine National Chapter. Kudos to the organizing team, the many men and women behind the scenes making the virtual rooms and presentations come alive. Thank you to all involved partners, from ISSUP Global to the Philippine government stakeholders, all subject matter experts and presenters, and to the hundreds of ISSUP members and supporters who participated in this week and are on the line right now. INL is very pleased to have supported this endeavor, and it's just one success in a long line of ISSUP accomplishments we have had the opportunity to witness and support over the years, from the very first national conference in 2017 to this event today. We planned a second national conference for 2020, but prudent pandemic precautionary measures required us to delay until later this year. As I mentioned on Monday, our work for people with substance abuse disorders has not been diminished with the threat of the pandemic. In fact, persons who use drugs have been one of the most vulnerable populations, and many of our speakers this week alluded to that. ISSUP has creatively devised this pre-conference to ensure our conversations and planning on this important work would continue amongst partners, members, and service providers. The last 3 days are a reflection of that hard work and ingenuity. This week, we had a firsthand look at all the great work and planning that has continued unabated in the face of the pandemic. You all didn't just look for the silver lining, you created it. We heard about so many exciting ongoing lines of effort. Some examples: the Anti-Drug Abuse Coalition from Kalibo, Aklan, developed a popular and creative approach to drug preventive education through social media engagement, performing arts, and a newsletter. Partners found ways to connect clients to services, avoiding the potential negative impacts of isolation. And they harnessed the power and use of technology, embracing our new normal to help communities who needed it most. Today, we heard about recovery efforts that have been undertaken during the pandemic, from Mayor Sotto to others. In addition to learning about new efforts, we also heard some important reminders. We were reminded that outreach should not focus solely on the most visible populations. In fact, we should focus our outreach efforts on the full range of people who use substances. As we learned from our UNODC expert presenters, there are a wide range of persons who use substances, but we have detected some common traits, putting users at higher risk for a poor outcome from COVID-19. Those people include drug users who reside in areas characterized by social deprivation, high population densities, or poor quality housing, and those who may be homeless and perhaps lack services. Mayor Sotto today also shared with us his thoughts on some of the impacts of the pandemic, and we appreciated hearing from him on that. The pandemic could have completely disrupted the continuum of care, but we've learned to realign programs to ensure we maintained evidence-based services, including provision of necessary medical supplies and support for families, as discussed in some of the sessions. Our experts also reemphasize how essential it is for us all to work together closely due to the cross-cutting nature of addressing drug demand reduction and ensuring addiction and mental health issues are addressed, despite the ever-changing landscape. Our UNODC Vienna Prevention, Treatment, and Rehabilitation Section partner highlighted this for us, noting effective supervision of drug treatment requires coordination among justice, education, law enforcement, and social services. INL, my office, our department, our government will continue to support these coordinating efforts. With our ongoing active and strong partnership with ISSUP and other stakeholders this week and in the future, we will connect, unite, and share knowledge on prevention, treatment, and recovery to save and support lives of persons with substance use disorders in our communities. 2 days ago, I shared that I looked forward to seeing what we could continue to achieve working together. I would like to reiterate that same sentiment today. I am confident that this pre-conference ISSUP has organized allowed us to all reflect, reinvent, and to aspire to reach our next goals. Ladies and gentlemen, congratulations on your participation. You made the best decision to be part of this ISSUP pre-conference. Salamat po. Mabuhay, and see you all hopefully this summer for the second national conference. Thank you all.
Thank you, Ms. Kelia. And like us, you two are part of the silver lining. So to everyone here now and who has been with us for 3 days, we'd like to say goodbye, mabuhay, and see you in June. Thank you very much. Olivia, thank you so much. Kat, thank you.
Thank you, Kat. Thank you,
Kat,
Kat.
thank you.
Olivia, thank you.